Good day, everyone, and happy Asian Heritage Month. We are grateful for this month. The Asian American community celebrates the Heritage Month. Magandang araw sa inyong lahat. Maayong adlaw sa tanan. Maupay nga adlaw ha iyo nga tanan. Buenos dias a todos, and welcome to our episode. Today, Wellness Waves of AAPINA-NV talks about HIV awareness. Be ready to dive deep into the wellness waves of AAPINA-NV, where we can talk about almost anything from physical, emotional, spiritual, and financial well-being. Our goal is to educate and empower the community. This is in collaboration with PHLV Radio, the only Filipino experience in Las Vegas, across the U.S. and the Philippines, and of course, the entire world. I am Zara Burines, a registered nurse and educator, and assistant professor at Nevada State University, and one of the Caritas coaches and leaders trained from Watson's Caring Science Institute. I am the immediate past president of AAPINA-NV. And I am grateful today since I am joined here with my co-host, Dr. Andrew Reyes. Andrew Reyes is the president of AAPINA-NV. So Dr. Reyes, can you tell me about yourself?
Thank you, Dr. Borinas. I'm also co-host for today's show, and I am the president of APINA of Nevada. I'm also an associate professor at the University of Nevada, Las Vegas School of Nursing. And together with us, too, is the president-elect of APINA of Nevada, Mary Lou Williams.
Hi, thank you, Dr. Reyes. My name is Mary Lou Williams. I'm the president-elect for Asian American Pacific Islander Nurses Association here in Nevada. I also work at Dignity Health St. Rose Hospital, Las Vegas Market as the Quality and Regulatory Manager.
Yay.
And welcome everyone.
That's good. Thank you so much. And we would like to congratulate Dr. Reyes. He was one of the awardees during the Tanglao sponsored by the PNA-LV Las Gala Night. So congratulations, Dr. Reyes. So we are honored today to have our special guests. We have here two special guests from our community. The first guest is Jessie Santos. So Jessie serves as a community health soldier and is the community service lead of the Community Counseling Center and a part of the medical case management eligibility team at the Dignity Health St. Rose Wellness Center. Originally, it was coming from Guam. Jessie moved to Las Vegas in the year 2000 and has since dedicated his life to uplifting others through his U equals U journey. I'm so intense right now about you and you. He will gonna explain it to us anyway. After being diagnosed with HIV in 2012, Jessie transformed his experience into a powerful source of strength and purpose and a personal blessing at the same time. Today, he is a passionate advocate for HIV awareness, prevention, and support, using his journey to inspire resilience and empowerment in the community. Welcome, Jessie. Do you have something to add with my introduction?
Absolutely, you guys. Thank you so much, you guys. And being from Guam, Hafaday and Totomalik, speak that in the native language. But also, again, just also part of the consortium, the Southern Nevada Health Consortium, being the treasurer to help out the companies as well. And again, everyone that you named is all we all work with. So it's really great to be here and very honored. So thank you so much.
Very good. Dr. Reyes?
Thank you. And our second guest, we have two guests today, is Albert Sedano, who is the Health Equity and Advocacy Program Manager at the LGBTQ Center of Southern Nevada. We call it the Center, and where they lead the Rapid Start program to connect clinics and clients to timely HIV care. He is also a national recognized award winner for his HIV advocacy. Albert Sedano created a sexual health journal for people with HIV that's made a lasting impact. They also teach a nationally accredited victim advocacy course, helping individuals navigate crisis with compassion and trauma-informed support. Welcome, Albert.
Mabuhay. Thank you so much for having me. It's such an honor to be here.
Thank you.
Thank you.
Okay, so I think we're ready for our first question.
Yes, to start, can you tell us about your role at the consortium, the center, and how your work in health equity and advocacy intersect with HIV awareness, especially during the Asian American Pacific Islander Heritage Month.
So, all right. So, as my title says, Health Equity and Advocacy Program Manager, I do work a lot around those realms when it comes to HIV. I like to think that a lot of my own lived experiences as a gay man on PrEP really lends itself well to connecting with people, to connecting with different agencies, to connecting with like medical professionals, to making sure that when we work with clients, when we work as a community, that we could really bring our best foot forward, whether that's using motivational interviewing skills or really pushing for more trauma-informed care to make sure that people are being seen, heard, and treated with fairness and kindness. So that way, when they're working with HIV, that it's a lifelong journey that we get to do together.
Excellent. Thank you.
Anything to add, Jesse?
Sure. I actually like the fact that when you shared something that Albert is really passionate about, and actually part of it's the crisis advocacy program as well, and being one of the people that work in that, it was really great. Speaking of HIV and the trauma that comes with it, it was really interesting to be a part of that and actually help clients that go through that same trauma. So especially when dealing with this, with the part of the consortium is we work with all the providers, and we want to make sure that we're basically the umbrella company to bring everyone together, all the organizations, even outside of HIV. So
That's right.
we all work side by side with each other and just want to be available. We all literally have each other's phone numbers just to make sure that we look out for the community, especially when it comes to Asian Pacific Islander. It's the numbers and the awareness is because of the stigma. It's a little bit more limited. So I try to make sure, and I know Albert agrees too, that we want to be those faces to make sure that everyone feels welcome. There's there's no reason why there should be any kind of shame. I know I dealt with that myself, and we just want to be very impactful, be that resource. We have a very eclectic community when it comes to Asian Pacific Islander in all dialects. So we want to make sure that we really welcome everyone and that it's okay. And we're here to support them.
Wow, that's powerful, Jesse. That is so good. Dr. Reyes.
Yes, thank you so much, Jesse and Albert. You made a good point about the stigma, especially stigma of HIV, especially among the Asian American Pacific Islander community. And research shows that Asian American Pacific Islander communities have some of the lowest rates of HIV testing in the U.S. And what are some of the reasons behind this, and what can we do to address it?
I think for the rates, to start on that part, the reason why it's so low, and I've actually got this study dealing from the health department, is that I think it's because people don't want to get tested. I think there's quite a few Asian Pacific Islanders that are living with HIV, and they, like myself, it was not something that you would do. Sexual health is not something you talk about in the house.
That's right.
And again, it's not necessarily shunned upon, it's just not looked at. It's not even addressed. It's very secretive. I had to understand education about sexual health later in life, and that was through experiences and the hard and the good times about it. But again, because those numbers don't want to get tested, there's such I really don't get a lot of Asian Pacific Islanders when dealing as a tester. I don't know if Albert went through the same thing, but it's very limited. And I think again, because of that shame, it's going to bring attention. Oh, they're going to see my name if I go to this location. So I think a lot of it has to do with those numbers being so small because of the people wanting to come forward to get tested, regardless of gender.
Absolutely, I totally agree, Jesse. And I think it also comes down to like our medical providers and our medical team to really encourage and try to make it so that way people want to get tested for HIV and that they get to sort of engage in their health in such a specific manner and they get to protect their own well-being in a specific manner. I know when it comes to talking about HIV and stigma, when I was going through my public health undergrad, I started going on PrEP, and I thought that'd be a great way to talk to my mom about like my own healthcare, about my own LGBTQ plus needs, about who I am as a person. And I remember telling my mom over the kitchen counter, I was like, "Mom, I'm starting PrEP." She's like, "What is that?" It's a medication to prevent HIV. I think it's great for me, and it's going to be a great way for me to protect my health. And I remember when I brought it up to her, she was quiet. She was stunned. She was silent. That kind of stigma that Jesse's speaking of, it stings, but I'm so thankful that I get to start that conversation with her, right? Because then it opens the door for so many. Because even though it stung and it hurt and it was really awkward and uncomfortable, I got to move past that, and now we're better than ever. We got matching purses like last summer.
That's
Yes, it is. Handbags are always important.
That is really true.
And sometimes it takes those questions and those personal encounters, even though they're uncomfortable, to actually even build a stronger relationship within family, when it comes to those kind of circumstances. Sure.
But you're really right. When I heard you last week, because, Marilu, we came to their event, and I was really like shocked, and I was so honored that I was there for them because I think I was just like blessed that I saw both of them in that event. That was like they were very courageous enough to tell everybody else what about your experience. So then the next question is about the stigma. So how can you encourage other people out there? Because both of you are out now. You're very courageous enough. My question is, how can we encourage other people to start that spark of a hard conversation with family, friends? And after all, we have to start somewhere. But how can you encourage our viewers?
I would say just like this, with everyone that's listening, do more podcasts, be more present. And we may not get a big turnout, but just showing that presence there is going to show more of a welcoming to that. Maybe going to other events as well and be present, even if it's at a festival. There's a lot of festivals all around, and I think that would be helpful. It might be uncomfortable. Maybe no one's going to go to the table, but they might see enough that you might get that presence there. So it's getting out of the normal events of what we do, even if it's here, and broadening it out in a more welcoming environment. That's at least it's there. They may not come to you and talk, but at least the presence is there, and that's important.
Yeah. That's really hard, I guess, but you're passed through it. As Albert said, we're passed through it. But how was the feeling, Albert, during that moment? I just want to go back to the feelings that you have, because we might have some of our viewers who will be in that boundary right now, that only one push and I will be out. So how can we encourage them? That we are already in the tip. We just need somebody to push out to be out.
Absolutely. And thank you so much. I really appreciate that question. I think a lot of it's, taking that initiative and knowing that, you're doing the best that you can, that when you show up for other people, you get to show up for a whole community, you get to show up for yourself, and you get to help change that narrative.
Yeah.
Right? Because even if it's a hard conversation, you still get to provide that opening and provide that presence and allow that space for questions, and allow that space for understanding. So that way people can hear you and see you.
Yeah.
And to go back to the stigma question, I think what a lot of it is just realizing that, they're just people with HIV, right?
That's right.
That oftentimes that there's certain things that we like to other, and we like to other someone with HIV because of a lack of information or because of a lack of judgment.
Yeah.
Right? Because for me, what really helps me on working the way I address stigma and my own biases is imagining that, what if I didn't know about PrEP? What if I was with a partner, just even with one partner who had HIV, then they didn't know about PrEP, or they didn't know how to be undetectable?
True.
I could have acquired HIV easily. Any of us can.
Yes.
Once we start understanding that we're all HIV possible, I think that's when we can become a lot more sympathetic, empathetic, and realize that this is not just something that's for gay people. That's not just something for XYZ communities, but it's for all of us, right? That when we're all engaged, when we all treat each other like family, like community, that we could really make something special happen.
Yes, I would agree with that.
Yeah, and Albert, you also made a good point last week during our community event at the center about HIV awareness, and that even medical providers themselves too, they have that stigma, right? When a patient sometimes would hesitate to ask for an HIV testing, other than, especially it's not even covered sometimes in insurance. And, and then when a patient opens up to have an HIV testing, you made a point that even medical providers would say, why would you need an HIV test or something? Would you more elaborate on that, about the stigma among medical providers as well?
Oh, absolutely. I have nothing but time to talk about stigma.
That's right. Go for it.
I remember earlier last year in October, I did a presentation to talk about our Rapid Start program to a bunch of medical providers in Texas who work in HIV. It was in Austin, I believe. It was 40 medical providers in a room, and I asked all 40 of them. I was like, hey, how many of us got tested for HIV in the past year? Please raise your hand.
Okay.
You want to guess how many people out of 40 rose their hands?
3.
Oh my gosh, you're very close. 4. But you see what I mean?
Yeah, wow.
Yeah.
My goodness.
Yeah, so there's a huge lapse in even our own personal selves of who's testing for HIV, right? Because all it takes is one partner or an unsterile needle to acquire HIV.
Yes.
And when it comes to things like asking or pushing to test for HIV, I remember one of my trusted friends and colleagues that I really adore and love, she encouraged and engaged with her medical provider and asked, hey, can I test for HIV? And the provider just like started to freak out. They started asking a bunch of pervasive questions, you know, and I understand like it's all in the form of protection and saying like, what can we do to protect this client in person? But also just take a minute to step back and think of like, how is this message being portrayed? How is this message being understood? Right? Because I know oftentimes we like to lean on like fear-based tactics to scare people into protecting themselves or scare people into from doing things that could be potentially harmful for them. But I think once we start opening up with honest conversations with neutral language to really understand and provide guidance for the person and understand that like we're trying to build a relationship here, right?
That is true. But do you also have like programs educating the providers? Do you have those part in your center that you're gonna go, you know, like go to the providers as well so that they will be aware of what's going on?
Absolutely. Yeah. I totally, you know, like Jesse said, I teach an advocacy course and we go through a 4-hour HIV course if you'd like. In addition, you know, like something that's really helpful is that I could even do like a 1-hour course on HIV and stigma. You know, 'cause a lot of times when it comes to HIV and stigma is the biggest things one of the biggest things when it comes to barriers in care.
Yes,
You know, that anticipation, the fear, the fear to ask for a test, the fear to go to your first appointment, the fear to take your medication, and what's going to happen to you, the fear of whatever else is going to happen. You know, and as someone who's not living with HIV, it's my duty to make sure that we're elevating voices for those who have HIV and that we're creating opportunities so that way people feel like they're heard and seen. In my national award, not to promote myself too much, but a lot of it came down to working with communities living with HIV so that way they knew what the messaging looked like, that they agreed to the pictures that was in there, that the format, and actually Jesse was there.
It sure was.
You know? Like, and that's what's so beautiful and special about our community here in Las Vegas is that we get to work with one another.
Absolutely.
We build that understanding and community.
And we have that understanding and we have that bond because, again, I'm living with HIV and Albert is not. And that's important, especially for the API community to know that, again, and just kind of adding on to what Albert was saying, especially when it comes to stigma, we know, especially when it comes to Asian Pacific Islander, religion is a big factor. You know, that family and religion plays even heavier. So again, HIV does not discriminate. There is no religion, there's no gender. So if anything we can encourage is to come in and get tested. We don't necessarily have to know what your preference is, just making sure that you're in having that healthy sex and at the same time you're taking care of yourself, because other than that, what your preference is not important. That we're just worried about your health care and everything. So we can encourage people to know that that shouldn't be the evasive questions coming from the provider. And Albert and the team is always trying to make sure with those educational courses to make sure to stay away from that stigma. You're only just putting more trauma. It's keeping them away from testing, and that's what's more important.
And talking of education as well, we already invited Albert to come to our school. So they could teach the new upcoming nurses. So actually, he will be joining us in the next few months. Yes. Okay, Miss Marilu, you have the next question for us.
Hi, we heard talk about PrEP, but many people were not aware of the PrEP. So can you discuss more further about the PrEP and how can we disseminate that to the community, especially focusing the Asian American Pacific Islander population?
So PrEP is pre-exposure prophylaxis. It's a medication that prevents HIV acquisition. There's 3 different forms. 2 of them are daily pills, and one of them is a long-acting injection that you acquire or you get with every other month. And what's great about PrEP is that it's for anybody, regardless of gender identity and sexual orientation, and that there's many ways to provide coverage so that way you can get that covered, whether it's through insurance benefits or different drug assistance programs. And in addition, you know, it's like fully effective within a month, some people within a week. And again, it's about engaging with your medical provider. And what's great for PrEP, when it comes to me at least, is that it encourages me to test at least quarterly, right? Because you don't know what you don't know.
That's right.
And the only way to know for sure if you have an STI, whether it's HIV, syphilis, or gonorrhea, is to get tested.
And you can only go for a PrEP if you're HIV negative, right?
Yes.
And as you said, is this covered by insurance or no?
Yes.
It is?
A lot of times it is, but sometimes you need like prior authorizations and you need to work with like a PrEP navigator to help get things happening.
And do you know how much does it cost if it will be out of the pocket?
Ooh, out of pocket. Yeah, I don't know if you want to know
$1,000?
that.
Because it's the same thing as the HIV medication, so it's again a lot of the same elements to it. So again, that pricing can be really pricey.
So how is that real pricing look like 5,000, 2,000?
2,000-ish, I believe, per
Okay.
injection.
And higher.
2,000.
And higher, depending on the medication.
Okay. All right. Now we have an idea.
Yeah, but
All
again,
right.
you can engage with different clinics, different providers, so that they can get you coverage, whether it's an FQHC.
Absolutely.
Or
Programs.
yes.
We always encourage the clients to go for PrEP, and I use it in the different way. Like I love it because with Albert living but as a person that's taking PrEP and having a good healthy sex life, and then I go from the other perspective in a very happier way. I'm like, hey, you know what? I'm at a different phase of my life because I'm positive, so let me help you get on that step. So that
That's
way,
right.
again, you can enjoy sex for whatever it may be. We're all about encouraging it,
Yeah.
but at least do something that you can, because there's something that I cannot change that you can.
Yes.
And I try to encourage it in a more
love
positive
it.
way, and then
Yes.
they understand it from there. So it's
love
not shaming them on having. Oh, but we're all human and everything.
Yes.
Have a very healthy sex life. Let's just make you more careful about that. Go see Albert at the center. He'll ask you questions. He'll answer those questions for you. You know what I
Wow.
mean? And it's always good. We definitely do that tag. We all communicate with one another, especially when it deals with circumstances, because we want
Wow.
people, especially in API, to feel encouraged and
That's
empowered.
right.
And we're completely the team there to make sure that happens.
And I think like from last week at the center, one of my big takeaways was this this harm reduction versus abstinence approach. Because if somebody wants to start on PrEP, sometimes they are hindered by, again, the stigma conversations within the AAPI communities about saying, why don't you just abstain from sex, right? Instead of having PrEP, for example, right? Can you say something more about that? Like, especially those who are sexually active, to protect themselves, and they are being confronted with these conversations. Why don't you just stop all the way of having, just be abstinent of unsafe sex or sex even?
Absolutely. As someone who's been on the receiving end of that kind of conversation,
Yeah.
I can tell you that people have sex because a lot of them enjoy it. Surprise, surprise. So I don't know if telling them to stop is going to be the most effective thing to do, right?
You're right.
Because if someone enjoys smoking, sometimes telling them not to smoke isn't going to be the most effective way to reach or understand them. But what we can do is we could build education, we could build toolkits, so that way people can enjoy sex with less stress,
Yes,
right?
yes.
That, they're engaging with things like prevent HIV, which is up to 99% effective, as well as things like DoxyPrep to prevent other STIs, right? That we're looking at ways to build collaboration and making sure that the person feels empowered and rather than shunned or shamed. Because when you're shamed, you don't want to talk about it. And when you're shunned, you don't want to engage, or you don't want to show up to your provider.
And kind of adding on to that too is by doing that, where you're feeling like you're shunning or shaming someone, usually that ends up, and again, I'm pretty sure, Albert, we've dealt with this, especially with our clients, that usually leads to more riskier behaviors because they're having to do things a little bit more. It just tends to that. I know that I've experienced that myself as well.
yes.
And I think that's the thing about it. Encourage them to have healthy sex. And that's great to have a healthy sex life, because when you deter them away from that and let them know that the tools and the services that can be for them,
Yes.
it just helps them from making those riskier behaviors.
Yeah.
Because then again, that's that stress, that trauma.
True.
I don't want to carry a bottle of pills around. That's okay. A lot of the pharmacies have ways and options so that way you don't have to carry it. There's pill
right.
packs and
Yes.
everything. There's always something to help take care of it. There's even PEP that's out there. Again, if anything, if there's an exposure and everything due to the riskier behaviors, we always have a resolution. We always have an answer, and we'll always provide that resource.
It's powerful. Did you know that? Because sometimes people are just so scared about it. I know we're talking of things that we should restrict, but people will go after it anyway. But your approach now is doing the preventive part of it, which is really every one of us needs it. Everyone, because we don't know what will happen in the future. So I love this platform that even so you have an HIV positive, you're on the approach of preventing that from happening, and the community could get it all from you guys. Right, so I have to pause at this time. I would like to get the news that there's news upcoming from Nevada State University. We are opening our master's degree. It's emphasis on leadership for 12 months. So if you're interested, it will start this coming fall of 2025. So please contact Dr. Michelle Odie at it's michelle.odie@nevadastate.edu. For those people who just joined us, please welcome to our episode, Wellness Waves. We are discussing about HIV awareness with Albert Sidaro and Jesse Santos. All right, next question, Miss Marilu.
my questions follow-up is, what role can community leaders, family members, or media, or even the storytellers plays in reshaping the narrative about HIV in the Asian American Pacific Islander community?
That's a great question. I think it's about looking at ways to we could uplift one another, right? That oftentimes that it's our instinct to like other or outcast someone with, you know, who's doing the wrong thing. I'm doing air quotes. I don't know if that's being understood. But nonetheless, it's, you know, looking for ways to how we can engage one another, right? Because it's such a scary time, I could imagine. I remember when I received a false positive diagnosis, I was scared. I felt alone. I didn't have that information of what it meant to have HIV, like what it could possibly mean to live long and live healthy, be undetectable, and all those things. Because a lot of times that's not advertised. That's not very well understood. So all I had with me was like those preconceived notions of what it means to have HIV, those old thoughts, that bad information that oftentimes like judges us and molds us to where we build up that stigma.
Yeah.
I would also say to normalize the conversation in a way that the approach is a little bit more simple. For me, when it came to HIV, I dealt with a really, really hard situation where my family found it out without me having to tell them. So that precious moment was taken away from me.
That's right.
Because again, that's not an easy conversation, especially for family that's not necessarily medically inclined. They're not going to understand it. In the API community, the minute somebody gets sick or they think it even has something, everything reacts. There's a reaction to it. So I did it a different way, and I'm glad I came up with this approach myself. I'm like, you know what? I can't force HIV on them. I can't put that education. Let me maybe put a pamphlet by, or if a commercial comes on TV, ask how they feel about that, because then it engages the conversation. It's more normal. If it's hanging out at dinner and there's something there and they ask about it, it's not forcing it there. It's letting that approach be, because then that will help educate them just a little bit. And even that little bit counts. And we all know that, especially with API, it's so different. It's a very, you know, you do look away from it if it's not, if it's something that's going to, especially going to shun, or it's going to put shame on the family, whatever it may be. That's that approach. It's more of a healthy, normalized approach. Make it an easier conversation than so medical, than so stern.
It's coming to stigma again.
Thank you.
Absolutely.
It's always coming to one thing. Dr. Reyes, you have the final question for our guests.
Okay, thank you very much. So, as we honor the Asian American Pacific Islander Heritage Month, what message would you want listeners, especially our AAPI folks, to take away about HIV awareness, testing, and self-advocacy?
Have healthy sex, you guys. By all means, live your best life and enjoy. If you have any questions, please do not hesitate to reach out to someone. There is, if it feels more comfortable talking to someone that is API, so that way it helps it. At least Albert and I we're two of many that are out there. But again, don't be afraid. You know what I mean? If it's something that you can easily approach, attend the events and just live your best life and be healthy about it. But just make sure to be aware of that prevention that's there, so that way you can enjoy for whatever it is. No stigma. We're there to support you.
Yes, I just love it. Love the message. Albert?
Absolutely. And, you know, I totally agree with everything Jesse says. And I think that, you know, it's all about engage, right? Like I've been saying that over and over again, not because I have a limited vocabulary, but, you know, it's just one of the most important things to me in my line of work, right? That the more we learn, the more we understand one another. When we look into things like U equals U, which is when you're undetectable, you're untransmissible, which is when the amount of HIV in your blood is so low that you cannot detect it through lab tests, that you cannot transmit through sexual contact. And there's now even enough information and data gathered so that way people can breast and chest feed when they're living with HIV, because there's a less than 1% chance of transmission, right?
Wow.
And living that you said in the beginning there, U equals U. So I'm very proud about that. And that's what I say is my armor. That's protecting me. And I want to make sure that people understand that even though you may have HIV in your API and you're nervous, come in there, be a part of the army. Because once you are, you'll realize how much more support is around you. And they're there to embrace you.
And
go ahead.
Oh, and I want to also add, you know, like, I keep saying community because I want to make sure that we emphasize this is a community problem, right? That we're looking at this as a big picture problem, that we're not judging someone for having sex, because these are all individual things that everyone, for the most part, does, right? Who hasn't had sex?
keep having sex.
Right? Right? Absolutely.
Safely, yes.
We have to encourage
Safely.
safe sex. That's what we're talking
Absolutely.
about, right? That's our message for the day.
And it's hard because our families will not ever encourage sex. That's
Yes.
something you talk about, but
It's
we're
not
all about
okay.
it, especially for the if we embrace it and we celebrate sex,
Yeah.
that's going to help the younger generation and anyone that feels that they're stigmatized to be able to enjoy it, but in a healthy way.
Yeah.
From two completely different worlds in the sense of PrEP versus HIV and U equals U, we got it because our worlds will intertwine.
Wow, I just love it. Any parting words, Dr. Reyes?
Yeah, thank you so much. It's really an eye opener, and also we hope that this podcast will encourage even those who are scared of it being tested. It's I
Yes.
remember many years ago too. When I had an HIV testing, and of course it was negative. I was just so scared. What would be the result?
There you go.
So we hope that we will go past that fear with all these conversations, one story at a time,
Yeah.
one person at a time.
Yes.
Oh, and one last thing, and me and Albert both know this too, and I always keep forgetting it when it comes to testing. Testing is completely 100% confidential.
Yeah.
So we
Okay.
can't even acknowledge if we saw someone that was
100%.
testing. So if we can pass that along, people think like, oh, are they going to see me? Are you going to say that you saw me? Nope, we can't acknowledge it. We protect people. That's everyone. And we want to assure that with the API community, it's completely confidential.
Wow, very good. Miss Marilu, parting words for us.
Well, we just wanted to thank you for your time and your knowledge and your expertise, sharing it to us in the community. It's very powerful, and I will learn a lot from this session.
Yes,
Thank you.
very good. So our takeaway for this episode, HIV awareness is really crucial for the community. We need to be tested, and we have to go to our providers. And remember, it's 100% confidential anyway. So we could request for testing, right? And if you're positive, then we could proceed for the treatment plan of it. Just follow Jess's recommendation earlier. But if you're negative, then we could have the PrEP for prevention. So we have to be mindful that if we have HIV positive, we still can do things. We can function as expected, but there's just like limitations. But it is still doable. So Jessie and Albert, thank you so much for your advocacy. This is very crucial for us, and we admire your courage and showing us in the community what alternatives can we do to sustain. Right? And their commitment for health equality and social justice continues to create safer, more inclusive spaces for all of us. So we should work together to educate the public about HIV. Thank you, PHLB Radio, for this privilege of working with you and educating the humanity. Thank you, Jessie and Albert, Dr. Reyes and Marilu. This is Zara Burinas from AAPI signing off. Thank you so much.